head and neck cancers are squamous cell carcinomas, or SCCs. This means that the cancer began in the cells on the thin surface layer, or epithelium, of the head and neck. Tumors of the head and neck need special attention because their location is close to so many sensitive parts of the body, such as the spine, esophagus, and salivary glands. Radiation therapy has incorporated advanced techniques to become a frontline treatment option for this highly complex disease. The first step in your journey is a consultation with your nurse and radiation oncologist. After a review of your medical history, symptoms, and diagnostic tests, your radiation oncologist will prescribe a treatment best suited for your case. You may need to undergo additional diagnostic testing, which could include X-rays, computed tomography, called CT scans, magnetic resonance imaging, or MRIs, positron emission tomography, or PET scans, biopsies, and blood tests. These diagnostic tests help your oncologist confirm the type, location, and stage or progression of your disease. You'll probably need a thorough exam from a dentist. Please visit with your oncology care team about your dental care, as there may be some dental work recommended before your radiation treatment begins. From the start, all of your information and images are gathered and managed electronically through a centralized patient information system called Mosaic. Mosaic enables all members of your treatment team, regardless of their location, to seamlessly share your test results, chart your treatment progress, check your prescriptions, and collaborate to manage all aspects of your cancer care based on real-time information. It's specifically designed to support oncologists and the entire care team throughout your cancer care.
The care of the cancer patient is entirely reliant upon the collaboration of all physicians, their staff, nurses, radiology, pathology. There are many team players that are involved in this.
We're constantly communicating, and I think that is important for continuity of care between providers and helps to improve outcomes.
After your consultation visit, your physician needs to verify the exact size, shape, and location of your tumor so that your precise radiation treatment can be planned.
After a patient is seen in consultation, if it's been determined that he or she would benefit from radiation therapy, the first step is what we call a CT simulation. That's where we send the patient to our CAT scan machine and obtain a mapping scan, basically a CAT scan through the area of interest where the tumor lies. That information then gets transferred to the treatment planning computer, and that's where we go to work to design the radiation fields.
Special immobilization devices support you to help you stay as comfortably still as possible. Your skin, or head mask if one is used, is marked with colored pens to help pinpoint the treatment area. Then, using a CT scanner, your radiation therapist acquires 3D images to exactly define your tumor and the surrounding area. These images are sent, along with positioning and immobilization details, to the treatment planning team.
So from there, using the CT images, we can define the normal structures, the tumor, the lymph nodes that may be at risk of harboring additional tumor, and design our radiation fields to treat the tumor, the lymph nodes, and try and spare as much normal tissue as possible.
Using sophisticated software, radiation treatment planning specialists can now calculate the exact details of your prescribed radiation treatment delivery. These planning specialists, a medical physicist, and a radiation dosimetrist work together to plan the intensity, shape, and path of the radiation beams. Their treatment delivery plan maps the way for the radiation to most accurately and effectively treat the tumor, while sparing as much as possible of the surrounding healthy tissue, organs, and critical structures, such as your esophagus or spinal cord. The planning process may take several days, up to 2 weeks, as your treatment planning team works with your radiation oncologist to develop and refine the best possible solution for your diagnosis. The radiation oncologist will review and approve the treatment plan in your Mosaic record. When you return for your treatment, you will be repositioned exactly as you were during simulation, and your radiation therapist will take some fresh images to verify your precise position for treatment accuracy. With its smooth, curved lines and soft lights, VersaHD was designed with patient comfort in mind. As treatment begins, you may hear some clicking and humming sounds or sense some movement, but the machine doesn't touch you, and the radiation is invisible and painless. VersaHD allows the beams of radiation to be shaped to conform to the size, shape, and volume of your tumor. This allows exceptional precision for the greatest effectiveness while avoiding healthy surrounding tissues in order to reduce the risk of side effects. Built-in safeguards and system checks support your safety during treatment.
We're watching them on a camera the whole time, and we can hear them too. So if anything would come up, they can either shout out at us, or if they're in a position where they're in a mask or something, they can just raise their hand or wave at us, and we can stop in the machine and come right in the room.
The treatment delivery on the machine is state-of-the-art. The speed at which we can deliver these treatments is as fast as anything that's out there. The ability, the precision and accuracy which we have with the VersaHD is amazing.
Each time you return for treatment, you'll repeat the process of setup, imaging, and treatment until your course of therapy is complete. Your treatment team will continually review and collaborate to make any necessary adjustments to accommodate tumor shrinkage or movement during the course of therapy. Your care team may recommend additional services as part of your treatment plan, like diet and nutritional counseling, homeopathy, naturopathic medicine, acupuncture, yoga, massage, exercise, or other services to help you look and feel your best throughout your treatment and recovery. VersaHD's extreme precision capabilities support advanced radiation therapy techniques and enable highly accurate cancer treatments. This supports a reduced risk of side effects to help get you back to your busy routine as quickly as possible.
Another goal of our therapy is to provide a treatment and side effects that do not interrupt their daily activities, their quality of life. Try to go about cancer treatment as almost another errand in their day.
The comfort of knowing that my treatment is not only precise and accurate, but can be delivered in a very short period of time allows the patients to get on with their life and not have to spend so much time here in treatment.
Even though you may be feeling fine after completing your course of treatment, it's important that you keep all recommended follow-up appointments. This allows your care team to monitor your progress and help you manage any side effects that you may experience.
If there's any side effects that maybe would be lingering towards the end of their treatment, we want to make sure that we follow up with those and make sure that those have resolved themselves.
Once a patient starts treatment, we will see them at least once a week to monitor how they are tolerating treatment. Are they having any side effects related to their treatment? If so, is there something we can do to help mitigate those side effects? Many times it's something relatively simple and very manageable.
Your oncology nurse, patient navigator, or social worker can also connect you with services and organizations that provide various types of support throughout your treatment and recovery. You may have thought of additional questions about your radiation treatment while watching this program. Your cancer care team is your best resource for answers that are specific to your case. Write down your questions for your next appointment so you can get all the answers you need to guide you on this journey. Remember, you are also an important member of the care team. To support your own healing process, inform your team of anything that seems physically or emotionally unusual.